Well, good afternoon, Miss Jones. My name is Ray Stafford. I'll be seeing you today.
Good to meet you.
We're just going to do a quick intake here. I'll ask you a couple questions. I want to know what's happening with you, and then after that we'll wrap it up and we'll continue next time.
Okay.
Does that sound okay?
Sure.
All right. Before we begin, I need to let you know there are some limits of confidentiality. Everything that you say in here will be kept between you and me, with very few exceptions. If I think you're posing a danger to yourself or to anybody else, that's something that I would have to report. If you report any sexual or physical abuse of a minor or a vulnerable adult, for example, someone who's elderly, that's something that I would have to report as well. Or if, for whatever reason, my notes are subpoenaed, I would do everything that I could to make sure that they're not, that they remain confidential, but there may come a point where I would have to give them up. And that would be only in extreme cases. Other than that, I just want you to rest assured that everything that you say in here with me will be completely confidential, kept between you and me.
Okay.
Before we begin, is there any questions that you have about that?
Not really.
Okay. Well, let's start. Can I have your full name?
It's Jessica Maria Jones.
Okay. And your date of birth?
February 12th, 1990.
Okay. Also, before we begin, I just have to let you know that I'm going to take a few notes. I have kind of a bad memory, so I like to jot things down so that I don't forget if I want to come back to it later.
Okay.
But I want to make sure that's okay with you before I do that.
Sure.
All right. And if you need to see these notes for any reason, they're really your notes. So I'm not judging you. I just need to remember some things. So if you ever want to see them, just let me know.
Okay.
Well, why don't we begin with you telling me what brings you in today?
Well, I've just been under a lot of stress lately, and I don't know, I'm having a hard time kind of trying to deal with things.
Okay.
I don't know, it's just been really exhausted and tired and lethargic and just not really wanting to go anywhere, do anything much, kind of isolating myself, but I just, feel overwhelmed with life, and then I just kind of, isolate myself and withdraw, and I don't know, I just want things to be how they were before.
Okay. So something happened that caused you, sounds like a good deal of stress.
I don't know if it was any one thing. I mean, I kind of always been like this. If I get too overwhelmed, I just kind of shut myself, out of everything, and, just kind of keep to myself until I can get everything together. It comes and goes.
You shut down?
Yeah. I just tend to stay home and not really talk to anybody or do anything, stuff gets too hard to handle. I just, withdraw myself from, the situations.
You said withdraw a couple times. Can you elaborate on what that means for you to withdraw?
Well, I mean, I'm in college right now, and I live in dorms, and it's, big, kind of a lot of people party and everything, and sometimes I'm just not in the mood, and everybody wants me to go out and hang out with them and go grab drinks or whatever, and I just want to be by myself and be alone. I even find myself sometimes going over to my parents just so I don't have to really be around anybody, and that sort of thing. Tend not to go out at all when I'm like that, or even really answer my phone.
So you get to where you just don't want to be around anybody else, and you find a place where you can be by yourself.
Yeah, exactly. So I don't have to, deal with too much going on. It's just like I can't even handle that when I get into these moods.
So you get into these moods, and you can't handle it. You said before you shut down.
Just shut down completely, and it's, it has a big impact on my social life and on myself when I do that, because it's like a cycle. When I do that, you know, people don't want to be around me, and I don't want to be around people, and it just kind of keeps feeding together until I can just pull myself out of this bad mood that I'm in. And some people don't understand it, so that tends to isolate me sometimes even more.
Yeah, I can understand that.
Mm-hmm.
You get to a position where you want to be alone, and people maybe you feel like are judging you, or
And where, you know, I mean, I can see where it might be frustrating for people. It's frustrating for me, but I'm sure it's frustrating for other people who want to do stuff and want to see me and care about me and everything. Just, you know, me push them away.
now you said these moods are cyclic.
Yeah, I'd say so. I mean, you know, it doesn't, I don't know. I mean, I can remember being, you know, teenager, probably 14, 15 is when this started. But it doesn't, I don't see any real pattern or anything. It just kind of happens.
So you get into these moods as far back as age 14, and you don't exactly know why?
No, I don't exactly know why. Like I said, it just seems like this happens where I don't know, I'll just wake up one day and I'll just not want to do anything.
And you can't find any patterns with it?
Not really. No, I'm trying to think. I mean, there's no real reason it started or anything. It's not like I had like a difficult home life, and you know, I always got along well with people at school. I always tried to be involved in like sports and stuff like that. But I can't pinpoint any like big event or something. Nobody I know close to me has like died or anything, or did when I started being like that. Like I said, it's just like I woke up one day and, you know, it seemed like everything was just terrible. I did not want to get out of bed.
So if I understand right, ever since you were 14, you've just, one day you woke up, you started to have these moods that come and go, where you don't feel like getting out of bed, you don't feel like doing anything. It's affecting you socially, personally.
And sometimes it'll last, you know, a couple months, you know, a couple times a year. But I don't know, it's you know, it seems lately, as I got older, or as I get older, it seems to happen more often than not. It seems to be longer periods of time. Probably, I don't know, I mean, it's more bad days than good days, really. I mean, there's, you know, certain good times at, you know, certain points in days, but generally it's, you know, just a dark cloud looming over me.
So when you first got these, they were only happening a couple times a year?
Yeah, and for, you know, a few weeks at a time. Like I said, as I got older, or as I'm getting older, it just seems worse and worse. I've never sought help for it before. And now, at this point, it just seems like, you know, I have to. Like, I always thought I could deal with it before, but it's just getting worse.
And that's what brings you in today?
And it is. My parents have, you know, worried about me for a while, but, you know, like I said before, I could usually force myself to do things. At this point, it's like I don't even have the energy to do it anymore.
And you said when you get these feelings, they last for a couple weeks?
No, now, I mean, at first, yeah, but now it just seems ongoing. Like I said, you know, once in a while there'll be a few days where it's like, okay, you know, I can do this and muster up some energy or whatever to go, you know, continue my regular activities. But yeah, now it's pretty much the majority of the time.
So when they started, it lasted for a couple weeks, but then as you got older,
It's longer and longer. Now it's to the point where it's just ongoing.
so it's a constant.
Before it was a little bit, and then, you know, it was fine, but now it's like all the time and just a little bit of break from it.
So it used to be a cyclic where it would come and go,
Mm-hmm.
and now as you're getting older, it's kind of this dark cloud, like you said,
Yeah.
it's hanging over you all the time.
Mm-hmm. Yep. So parents are worried about me, friends are worried about me, I'm worried about myself sometimes. I know it's not healthy to be living like this.
What do you mean?
I mean, I'm not suicidal or anything, but it's like, you know, sometimes I think like, well, maybe things would be easier if I just didn't wake up. He said, you know, I'm not a suicidal person or anything like that, but when you're so down all the time, it's just hard to think about anything else.
Right.
Mm-hmm.
It just weighs on you.
Mm-hmm. It does.
You said it'd be easier. I think sometimes if you just didn't wake up. Can you elaborate on that? What does that mean? It would be easier.
I mean, life just, you know, I wouldn't have to feel so sad anymore.
So it started when you were 14. It's gotten progressively worse
Mm-hmm.
because it's not going away. You're not getting the reprieve from those feelings.
Yeah, I mean, you know, people always talk about when you're a teenager, it's rough, and I guess I kind of always just attributed it to that, where, you know, I was just getting older and things were changing, and I just wasn't adapting as well as some of my peers. But now it's like, you know, it's beyond that. I'm not a teenager anymore. And, you know, I know adulthood is still a transition, and so is college, but my friends and stuff, it doesn't seem, you know, they don't seem to be as affected by everything as I am.
And you've been dealing with this now for 9 years.
Mm-hmm. 9 years. Like I said, I just kept on convincing myself all the time that it was going to get better. And, you know, it's just, you know, transition after transition, and, you know, that's why this was happening, but it's not.
Transitioning into adulthood.
Yeah, and just, you know, everybody says, oh, it'll get better, you know, first it was you're a teenager, you're just going through a lot of stuff, and, oh, you're becoming an adult, you know, it's just a lot of stuff in college, it's just a lot of stuff, and, you know, I think that's true to an extent, but not to this extent.
Right.
Mm-hmm.
You have these confusing feelings, and then tell people about them, and they kind of
Don't
minimize.
understand, yeah. Like, you know, just, oh, get over it, you'll be fine.
Okay. So you started having these feelings at 14, and you're not sure why.
Because I think it was about 14, yeah, and I just woke up one day and it's like, how am I going to get through this day?
Yeah.
And, you know, this terrible, that feeling just like you're drowning or something.
Can you describe that? What that
Just like
feeling is?
you can't breathe, you're just, everything is a struggle, like with, you know, so I imagine somebody that's drowning and they're trying to get like a breath of air, just, you know, just one breath of air so they can continue on. And that's kind of how this feels, like you're drowning.
So every day it's just a struggle to
Mm-hmm.
breathe even.
Mm-hmm. Everything.
That sounds scary.
Yeah.
How old were you when you first started having these? 14?
Mm-hmm.
And you said that they went a couple times when you were 14,
Yeah.
but then they would go as you get older now,
Mhm.
almost 10 years into this, into your
Yeah.
symptoms here. It's a constant
Yeah.
constant struggle. It's
Mhm.
constant, just a weight on you.
Mm-hmm.
And you said the social aspect and the personal aspect were really impacted.
Mm-hmm.
It's really impacted by your
Yeah.
symptoms.
I mean, people don't understand, you know, what my problem is. And then, I mean, even schoolwork, my grades have taken a real hit. I just can't find the motivation to do anything.
Your grades have taken a hit since you were 14, or has...
No, it's been getting worse and worse. So since I started college a few years ago, started when I was 18, so 2 years ago, or 3 years ago now, I suppose. Yeah, I mean, I started off with pretty good grades, like B's and stuff, and now, you know, I struggle to get my C minuses, which is like the minimum you have to get before you fail. It's hard.
So academically, it's really been a struggle as well.
Mm-hmm.
When you first got these, your grades suffered cyclically, like the symptoms?
Yeah, I mean, when I would feel down, I just kind of wouldn't do my homework, but it wasn't that big a deal because I always got good grades. Missing a few assignments didn't really, you know, impact my grade too much because, you know, it was just, you know, a week here, a couple days here, you know, if I didn't turn it in, I could catch up, but now it's like, you know, just struggling to maintain everything right now. It's not even a matter of catching up. It's like forcing myself to do the very bare minimum to get by.
Right.
And I can't, you know, let alone trying to excel in anything, I can't.
That's got to be frustrating.
Mm-hmm. It is, because I know, you know, I could be a good student if I want to. I can't. I don't have the time, or, I mean, I do have the time, just don't have the energy.
Right.
Mm-hmm.
Because you have this weight on you. If you have a hard time breathing, it's a hard time writing papers or
Mm-hmm.
reading.
Yeah.
Okay. If I treat you effectively after we're done, what does that look like to you?
I mean, I think, you know, utter and complete happiness all the time is unattainable for everyone. I just want to feel like I'm doing more than just meeting my basic needs. Like I can, you know, have energy enough to do things I want to again and be, you know, I just want to be a normal person.
Right.
I know normal people struggle and are happy and they find a balance. I just want to find a balance.
You want to do more than just survive.
Mm-hmm.
You want to.
Mm-hmm.
Okay. All right. Well, that wraps up our time for today. When we meet again, we'll pick up right here and we'll continue this along.
Okay.
Thank you for coming in today.
Thank you.